Today we'll talk about vitiligo treatments, including topical therapies, oral therapies, light therapy, and surgical therapy. As always, this is for informational purposes only. This is not medical advice. Enjoy. Hi everyone, welcome back. We're going to talk about vitiligo treatment today. Now, vitiligo is not a life-threatening condition, but it can significantly impact our quality of life. So we're going to talk about the goals of treatment. Although vitiligo cannot be cured, it can be treated, and there are multiple treatment regimens that we can provide for patients. But the treatment regimens take a while. They can often be slow to work, and it is definitely a practice of patience when treating vitiligo. So we're going to start with our topical therapies. First and foremost, topical steroids. Typically very safe as long as you take the appropriate breaks so that you don't have skin thinning, stretch marks, visible blood vessels, acne bumps, things like that. You can use various types of steroids. Typically we like to use high potency or super high potency steroids, meaning very strong steroids, as these typically work best for vitiligo. There's another class of medications called topical calcineurin inhibitors. These actually lead to immunomodulation on the skin, but in a way that's different than steroids. So they don't hold the same side effects as typical corticosteroids. So that skin thinning we previously mentioned is not here with the topical calcineurin inhibitors, an example of which is Protopic or tacrolimus. These are effective anywhere, including the face and the neck areas that sometimes we don't want to put topical steroids on for too long. And there are some side effects. Typically burning and itching is what we counsel on. There can be some increased sun sensitivity as well. Topical JAK inhibitors. We'll dive into this now as well as in a video regarding future treatments. But JAK inhibition has taken the stage in dermatology over the last few years for various conditions, including atopic dermatitis and eczema, and now for vitiligo. Topical JAK inhibitors block the inflammation. They're also an immunomodulator, but they work differently than steroids. The main side effect that you can appreciate is acne. Otherwise, they are very safe, topically applied to the skin in a limited body surface area. Here's an example of the FDA-approved topical JAK inhibitor, Opzelura. So let's break down this graph. The green-blue line is the Opzelura that was applied to the vitiligo twice a day. The dashed line is the vehicle, meaning just the cream without the medication in it, applied twice a day. Then, after 24 weeks, that bottom line, the dashed line, started applying the Opzelura. As you can see, those that started applying Opzelura from day 1, by 24 weeks, 31% of them had a response, while 10% with just the vehicle. And as they continued to apply it, both parties with Opzelura continued to improve, up to 51% for those that started with the medication and 28% by 1 year for those that started with the vehicle only. Another graph here shows the sustainability of this medication. As you can see, this got pushed out to 104 weeks or 2 years. And you can see that from day 1, 66% of subjects found improvement with the Opzelura and 47% with those that started with the vehicle and then transitioned to Opzelura. In clinical practice, I find that Opzelura works quite well for many of our patients. Typically, we start them on topical corticosteroids or calcineurin inhibitors to assess their response. If they fail, meaning they don't see significant repigmentation, we typically then move to Opzelura and navigate that with their insurance to provide them the best topical care with the only FDA-approved medication. Just to clarify, this is not an ad for Opzelura, but the data shows that it works quite well, and in my own clinical experience, I found that it helps patients quite a bit. Light therapy is a tried and true treatment for vitiligo. When the light touches the skin, it stimulates repigmentation, and we'll dive into exactly the mechanism and how that. Many patients find significant improvement with this treatment, particularly if their vitiligo is widespread and is not amenable to topical creams. So here's a nice schematic regarding how light therapy, whether it's PUVA, which is a deeper UVA treatment, eczema therapy, which is a laser-based narrowband UVB treatment, and then typical narrowband UVB treatment, which is what I think most practices have. So it leads to T-cell apoptosis, meaning the T cells, the immune cells that maybe are killing the melanocytes and causing this depigmentation. Those T cells die and allow for repigmentation. We have functional development and migration of melanocytes. So this stimulates melanocytes to move into the depigmented areas, typically from the hair follicles, and melanocyte migration from perilesional skin. So melanocytes, the cells that make the pigment, moving in from the corners of the depigmented skin. So these are all proposed mechanisms for the light therapy. So let's talk about oral medications and combination therapies. Really, the oral medication right now for vitiligo is oral corticosteroids, typically in a pulsed manner and typically for patients who are having a rapid progression of their vitiligo, meaning it is advancing very quickly. This is not a treatment that can be safely applied long term given the side effects of oral corticosteroids. There will be a video in the future regarding advances in vitiligo treatment, and in the next 5 years, I believe there will be oral therapies for vitiligo that are safer, including oral JAK inhibitors. Now, regarding combination therapy, this study found that a combination of the Excimer lamp, which is that narrowband UVB, and a potent topical steroid led to significant improvement compared to just the light itself. So that will be demonstrated here in the graph, where you can see degree of repigmentation, with the orange bars signifying combination therapy and the blue bars signifying monotherapy from the light only. By the 12th week, 87.5% of the lesions treated with the combination regimen and 50% with the monotherapy showed good to excellent results. So both worked, but combination treatment worked better. Surgical treatments. These are less often deployed, typically because of the skilled nature that's required to perform these procedures and the limited availability. This is often confined to specialty clinics, specialty providers. In a future video where I discuss advances in vitiligo treatment, I will talk a little bit more about melanocyte stem cell transplantation. But typically, what was done historically is transferring skin from a donor site to a recipient site, often through things like punch biopsies, among other surgical procedures. Depigmentation. Ultimately, vitiligo can be so widespread that the goal for the patient is to actually depigment or lighten the surrounding normal skin to match the vitiligo skin. You can think about Michael Jackson as a famous example of this. This is done with monobenzone, which is FDA approved for depigmentation. This should be done with a specialist to monitor response and to ensure there's no adverse effects. So cost variation and availability. We find that the topical treatments and often the light therapy are readily available in most dermatology clinics. Medical treatments are typically less expensive. Opzelura, which is the new topical JAK inhibitor, can be a little bit more expensive, but there are ways to navigate that with specialty pharmacies, as well as with the company that makes Opzelura. Surgical modalities, like we mentioned, are a little less common and a little bit more expensive. After using the first-line topical agents, I find that most insurance agencies will cover the subsequent therapies, and I have not had an issue also getting light therapy for my patients. But it's important to discuss this with your dermatologist, with your provider, assure that there's proper documentation. If there's a denial, it's really important to appeal. There have been multiple cases where I've been denied 1, 2, 3 times, and on the 3rd and 4th appeal, ultimately, I'm able to get the medication or the treatment for my patient. So vitiligo, not dangerous, but can significantly impact our lives. Although there's no cure, there are various treatments, and I assure you there will be more treatments in the near future. Treatment can be slow. It can require months to years of due diligence. And again, the future is looking bright. There is a lot of money going into vitiligo, and I think there will be great treatments in the near future.